A new report from the World Health Organization, WHO, has revealed a troubling decline in condom use among adolescents across Europe, exposing young people to a significantly higher risk of sexually transmitted infections, STIs, and unplanned pregnancies. The findings, based on extensive research conducted between 2014 and 2022, paint a concerning picture of declining sexual health awareness and increasing vulnerability among teenagers. The study surveyed over 242,000 15-year-olds across 42 countries and regions, highlighting the urgent need for immediate intervention. The data shows a clear and alarming trend. The percentage of sexually active boys using condoms during their last sexual encounter dropped from 70% in 2014 to 61% in 2022, while the rate for girls declined from 63% to 57%. Even more worrisome is that nearly one-third of adolescents reported having unprotected sex, meaning they used neither condoms nor any other form of contraception. This stagnation in safe sex practices signals a failure in providing young people with the necessary education and resources to protect themselves. One of the most pressing concerns is the link between lower condom use and a rise in preventable health risks. Unprotected sex significantly increases the likelihood of contracting sexually transmitted infections, some of which can have lifelong consequences, such as infertility or chronic health conditions. Additionally, the risk of unintended pregnancies places an enormous burden on teenagers, potentially disrupting their education, career opportunities, and mental well-being. Given that unsafe abortions remain a leading cause of maternal complications worldwide, the potential dangers of this trend cannot be overstated. The report points to multiple factors contributing to the decline in condom use. One of the key issues is the lack of comprehensive, age-appropriate sexual education. In many countries, sex education has been under increasing scrutiny, with some critics falsely arguing that teaching young people about contraception encourages early sexual activity. However, research consistently demonstrates the opposite. When adolescents receive accurate information about sexual health, they are more likely to make responsible choices and engage in safer practices. The failure to provide this education leaves young people unprepared, relying instead on misinformation from peers, social media, or other unreliable sources. Another significant factor is the disparity in access to contraception. The report highlights that teenagers from lower-income backgrounds are less likely to use condoms or other forms of birth control, with 33% of adolescents from disadvantaged households reporting unprotected sex compared to 25% from wealthier families. This gap underscores the need for affordable and easily accessible contraceptive options for all young people, regardless of their socioeconomic status. Although the findings are deeply concerning, they also serve as a call to action. Experts stress the need for immediate, data-driven policies that prioritize sexual health education, improve access to contraception, and foster open conversations about safe sex. Governments, healthcare providers, and educators must work together to ensure that teenagers receive accurate information and the resources they need to protect themselves. Without such efforts, the current trajectory could lead to rising STI rates, increased healthcare costs, and disrupted futures for many young people. The decline in condom use among adolescents is not just a statistic. It reflects a failure to equip young people with the tools they need to make informed decisions about their health and well-being. Ignoring this crisis will only allow the situation to worsen, putting more young people at risk. Comprehensive and science-based interventions are not just necessary, they are a moral imperative. If action is not taken now, the consequences will be severe and long-lasting, affecting not only individuals but society as a whole.